Hello and welcome. Today we're going to talk about planning a retirement budget, a friendly step-by-step guide especially for seniors. Retirement is an exciting time, full of freedom and new possibilities, but with that freedom comes the need to manage your finances wisely so you can relax and enjoy your golden years. We'll explain how to estimate living expenses, account for healthcare and insurance, understand income sources like Social Security and pensions, share expense reduction tips, and build a simple retirement budget. Let's get started. Estimating retirement expenses. Start by figuring out how much you'll need monthly in retirement. A common rule of thumb says you'll need 70% to 80% of your pre-retirement income. For example, if you earn $50,000 a year before retiring, aim for around $35,000, $40,000 per year in retirement income. Review your current expenses and note what might decrease, like commuting, or increase, like healthcare or hobbies. Most retirees find that early retirement years are more active and spend heavy. Break down your budget into needs versus wants. Essentials: housing, food, utilities, transport, insurance. Wants: dining out, vacations, entertainment. Cover needs with reliable income, like Social Security or pensions. Accounting for healthcare costs. Healthcare is a major retirement expense. Even if you're healthy, plan for insurance premiums, medications, and unexpected costs. Medicare covers many things but not everything, and it's not free. Medicare Part B doctor visits and Part D prescriptions have monthly premiums. You may also need supplemental insurance like Medigap. If you retire before 65, budget for private health insurance or COBRA. Medicare covers about 80% of approved costs. Out-of-pocket costs, dental, vision, hearing aids, and long-term care often aren't covered. Many retirees spend $250,000, $300,000 on medical care over retirement, not including long-term care. A nursing home alone can cost over $100,000 per year. Include small health costs like OTC meds, and remember, healthcare costs rise faster than inflation. Build a buffer into your plan. Income sources in retirement. Your paycheck is replaced by Social Security. Most retirees get a portion of income from Social Security based on your earnings, and when you start taking benefits as early as 62, as late as 70, delaying increases your monthly amount. Social Security generally covers 30%, 40% of retirement needs. Pensions. If available, pensions provide fixed monthly income. Less common today, but still valuable if you have one. Savings and investments withdraw from 401k IRA or savings accounts. A common guideline is the 4% rule. Withdraw 4% of your total savings yearly to make it last 30 years. Be mindful of taxes on withdrawals and required minimum distributions in your 70s. Other income. This might include part-time work, rental income, annuities, or dividends. Don't rely too heavily on part-time jobs, as your ability to work may change. List all expected income monthly. Match this against your expenses to see if there's a gap. Tips to reduce expenses. Housing. Try to pay off your mortgage before retirement. Consider downsizing or relocating to a lower-cost area. Cut unnecessary bills, cancel unused subscriptions, drop a second car, reduce luxury spending. Use senior discounts restaurants. Travel, insurance, and retail often offer special rates. Avoid overspending early. Don't burn through savings in your first few years. Spread fund money across time. Account for inflation. Food, housing, and utilities will cost more in 10-20 years. Adjust your budget over time. Maintain an emergency fund. Have 3-6 months of expenses available for surprise bills. Minimize debt. Avoid credit card debt. And plan to pay off loans as early as possible. Tax awareness. IRA 401k withdrawals and Social Security may be taxable. Plan ahead. Building a simple retirement budget. 1. List all monthly income, Social Security, pensions, investments, annuities. 2. List fixed essential expenses. Housing, insurance, food, utilities, healthcare. 3. List discretionary flexible expenses. Travel, hobbies, gifts, entertainment. 4. Compare income and expenses. Ensure income covers at least your essentials. Then allocate to fund spending. 5. Track and adjust over time. Review your budget every 6-12 months and tweak based on real life. Extra examples and mistakes to avoid. Let's look at a sample scenario. Monthly Social Security, $600. Small pension, $600. IRA withdrawal, $700. Total income, $2,900 a month. If your core expenses, housing, insurance, food, etc., total $2,300, you have $600 left for travel, hobbies, or savings. This buffer helps if prices rise or emergencies hit. Common mistakes include ignoring taxes on IRA 401k withdrawals, underestimating healthcare costs, overspending in early retirement, forgetting to adjust for inflation. Be honest with your numbers and revisit your plan once or twice a year. Final thoughts. A good budget brings freedom. It gives you permission to enjoy life. Because you know your essentials are covered, don't think of it as restriction, think of it as confidence and peace of mind. Thank you so much for watching. If this helped, give the video a like and subscribe. Share your own tips in the comments. Your experience could help someone else. Here's to a joyful, well-planned retirement.